COVID-19 has not yet reached the level of community transmission in the country. This even as the agency confirms 8 more B117 infections. But for a research group, the surge of cases in Cebu may be due to another level of transmission already. An official from the regional office of the DOH corroborates this. The country's total COVID-19 caseload has breached the 535,000 mark with over 1,900 new infections. Around 95% of the active cases are either mild or asymptomatic. The Chinese government has formally approved Sinovac's vaccine for public use. The move comes as our Food and Drug Administration continues to address the shot for deployment in the Philippines. And the vaccinations across the globe have surpassed the total infections. The World Health Organization views this as a remarkable event. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Griza Diaz. The Health Department insists that there is no community transmission yet of the new and more transmissible COVID-19 variant. JC Cosico has the report.
Nothing is certain yet. This is how Health Undersecretary Maria Rosario Vergere clarified claims that there is already a community transmission of the B117 variant.
For now, nothing is certain. There would be a lot of factors that can contribute to this increase in the number of cases. But of course, there would always be that possibility that there is this transmission ongoing in that specific area. That's why we are trying to investigate properly.
Vergere explained community transmission happens when health officials can no longer establish linkages between new infections and the index case. She clarified that what we have instead is local transmission, where new infections can still be traced back to the index case. The health official maintained that the minimum health protocols will remain the same, regardless of the coronavirus variant. But biosurveillance efforts as well as local quarantine and testing capabilities should be expanded to immediately detect infections and prevent further spread.
We need to do really is to do surveillance. Another thing would be that the local government should be able to strengthen their isolation and quarantine and testing procedures.
Meanwhile, preparations for the vaccination drive in various LGUs such as Navotas City are already underway. City officials say they are targeting to inoculate 2,000 residents daily or a total of 107,000 residents in its 20 vaccination centers. The LGU is also considering tapping the parish of San Jose, the biggest church in the city, as an additional vaccination site. Local officials also inspected the city's cold storage facility at the Navotas Polytechnic College, with 3 freezing units that can store more than 200,000 doses. But City Health Officer Dr. Chris Chapadolina said vaccine hesitancy is still an issue among residents.
The common question was, safe ho ba ang bakuna? Meron ho ba kami ine-expect na side effect? At kung meron, tolerable ho ba?
Padolina said they are also concerned about the brand of COVID-19 vaccines.
We rank the choices of vaccine and the top 3 included Pfizer, Moderna, and AstraZeneca. So in that regard, the decision on what to procure was glued on that statement.
Navotas is among the LGUs that signed a procurement deal with British-Swedish firm AstraZeneca. The city is also expecting vaccines from Moderna and the COVAX facility. For News 5, JC Cosico, We Are One News.
But a research group says the surge of new COVID-19 cases in Cebu may be due to the community transmission of the B117 variant, warning that we may only be seeing the tip of the iceberg. Speaking to us earlier, Austriaco says the detection of the new variant in Cebu would explain the steep increase in infections that was also seen in the mountain province.
The explosive increase that we have seen in Benguet, in Mountain Province, and now in Cebu. And the detection of the B117 variant explains why this is the case. So B117 is probably in community transmission in Cebu.
Austriaco also says there may be more cases of the new variant that remain undetected. The research fellow explains that this is because the B.1.1.7 variant is 50% more transmissible than the first and more common variant, which leads to a spike in new COVID-19 cases.
It's actually statistically very likely that what we are seeing now is just the tip of the iceberg. The new case, especially in the Visayas, is particularly troubling, but actually not unexpected because of the recent surge in cases there is typical of populations where B.1.1.7 enters.
The DOH's office in Region 7 also says there is a reason to believe that a community transmission of the new COVID-19 variant is already happening. In an interview here on One News, Dr. Mary Jean Loreche, Chief Pathologist and Regional Spokesperson for COVID-19 in DOH Central Visayas, said COVID-19 can undergo mutation at a given point in time, particularly when there is so much transmission going on. Loreche's statement came after the DOH confirmed that 2 individuals with addresses in Talisay and Liloan, Cebu, have tested positive for the UK variant.
We were already thinking that 2 things is happening here. One is the probability of the UK variant that we are missing out. Because remember that we do not conduct genomic sequencing here regularly in the Philippines. Secondly, there is also the possibility that there is another variant that is local in nature.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The Health Department reports over 1,900 new COVID-19 infections. That brings the country's caseload to above 535,000, nearly 36,000 of which are still considered active. Around 95% are asymptomatic or mild cases. The virus killed 52 more patients in the past 24 hours, pushing the death toll to over 11,000. Some 488,000, meanwhile, have gotten better from the disease, with 234 new recoveries reported today. The DOH also confirms 8 additional cases of the UK COVID-19 variant in the country, bringing the total number to 25. Experts are looking at 5 to 6 known variants of COVID-19 around the world, which may be a cause for concern given their kind of mutation. Bloomberg speaks with a public health expert to find out more, so let's watch this.
We have our main variants that everyone talks about, the UK, the South African, the Brazil variants. We're seeing other viruses that are unrelated to those, acquiring some of the mutations that we think are important for these new variant spreads. And we're also seeing the variants accumulate a few more mutations. So right now it looks like there's 5 or 6 of these variants that I would say are of concern out there, because they possess mutations that we know will either affect transmission or would affect the ability of antibodies to bind to them. Now, the good news is is some of the studies, particularly some of the more recent vaccines, have been looking at efficacy against these variants, and most of the vaccines continue to have some efficacy against the variants. It drops a little bit compared to the older strains, but the efficacy is still there. So I think the message when it comes to vaccines is, if you're online, stay online. When you get called to get online, I would get online, because these vaccines are going to provide protection and they're going to help reduce the spread of the older strains as well as the variants.
Andrew, we also seem to be hearing that a number of companies or even countries are looking at combinations of their vaccine shots to see whether they're more effective. I think the latest news was Russia talking to China. Could it be the right way forward?
Absolutely. It takes some clinical trials to make sure that you can go across these vaccine platforms as efficiently as some of the within-platform boost strategies are. But anything we can do to maximize the number of vaccines that we could use together will help us move forward to that goal of getting as many people as possible with the highest level of vaccine of immune protection, because that's what we need to get into the human population.
Andrew, the only question really that people want to know is, how do we slow death rates, and of course, when might life return back to normal? We have a new vaccine tracker here at Bloomberg, and it tells me in 7.4 years at today's vaccine rates. But how much will the rates actually accelerate?
Yeah, so this is the important thing about models. You know, models tell us where we might be going based on the data that we have right now. And vaccine trackers are really important to help us understand what might be the best way to roll out vaccine and how the rollout will change. It's clear that the vaccine trackers will be changing their projections as we continue to increase our manufacturing capacity. And something as simple as even the J&J vaccine coming on the market could have a massive change in terms of the timeline in which we could get to a protective level of immunity in the population.
And here are other stories from around the world. Sinovac, a biotech, says its vaccine has been formally approved for public use in China. This is now the second vaccine to secure regulatory approval in China after state-owned Sinopharm acquired theirs last December. At least 7 countries worldwide have granted emergency use authorization for Sinovac's shot. Philippines, on the other hand, has secured 25 million doses of Sinovac, the first batch of which is being targeted to arrive this month. Travelers entering the United Kingdom from COVID-19 hotspots will be required to undergo a 10-day hotel quarantine upon arrival. The travel policy applies to passengers coming from countries under Britain's red list, which includes South Africa and countries in South America. This comes after criticisms that the British government was not moving fast enough in managing its borders following the impact of the new COVID-19 variants. And the World Health Organization confirms that the number of vaccinations have surpassed the total infections worldwide. WHO Director General Tedros Ghebreyesus says this is good news and a remarkable achievement in such a short time frame. He, however, notes that around 130 countries have yet to administer a single dose. This has prompted the organization to call for a massive scale-up in vaccine production to address the supply gap. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.